Thank you, Fiona, and thank you everyone for taking time out of your busy schedules to tune in. This evening, I will be talking about Fit for Life, how to maintain strength, fitness, and a healthy lifestyle as we age. I will plan to summarize some of the evidence base regarding healthy aging, particularly as it pertains to golf performance, and offer some practical examples of what you can do to help improve your own fitness and golf performance. But just don't blame me if your handicap doesn't come down this summer. I think it's well understood the importance of being fit for a myriad of lifestyle factors, such as benefits, such as general health, longevity, mental well-being, weight management, etc. But what do we mean by being fit? Fit means many things to many people, whether it's group or individual activities, indoors or outdoors, casual or competitive, cardiovascular-based, or strength or flexibility-based. Tonight, we're more interested in fitness as it pertains to golf. We can likely all agree that Rory is a fitter golfer than John Daly, but that being said, not many of us would fancy going toe-to-toe with John Daly on the golf course or in the clubhouse bar. It's outside the scope of this talk to talk about the technical factors that contribute to golf. For that, you've got to go to your golf course or your golf pro, but instead we'll talk about some of the physical factors and what we can do to change them to help improve our golf performance. Firstly, I'm going to talk about the importance of muscular strength. So why is strength important? Well, I'm sure anyone who has watched the Netflix Full Swing documentary has seen this custom-built, state-of-the-art gym that the PGA Tour bring with them around the country to all of the major events to allow all the elite golfers maintain their strength and conditioning work whilst on tour. But strength is also important for the aging golfer. Aging is commonly associated with a loss of muscle mass and strength, which can often result in falls, functional decline, feelings of subjective weakness, or on the golf course, that might look like a loss of distance or fatigue. Again, like as I mentioned, typically as we age, we see a loss of muscle mass. This is shown here in this study with these two MRI images, one of a 60-year-old woman versus an 80-year-old woman. And basically what we're looking at here is the muscle mass, so the darker material, versus the white material being more fatty infiltration. Okay, as you can see, as we age, typically we see the number and size of that muscle mass. In this instant, this is your quadricep muscle, and we see that decrease, whilst we see the fatty infiltration and collagen increase. However, this does not have to be the case. This particular study looked at 40 masters athletes aged between 40 to 81 years old who trained 4 to 5 times a week. During this study, they underwent tests of body composition, quadricep strength, and bilateral MRIs shown here. And what we can see here is that a 40-year-old masters triathlete relative to sedentary versus an active population. And basically what we see here is that the muscle mass, size, and number of muscle fibers maintains really well in that active population, versus in our sedentary population, what we see is that increase in adipose or fatty infiltration into the muscle. So ultimately, this study contradicts the common belief that as we age, we lose muscle mass and strength, and perhaps suggests that that loss of muscle mass and strength that we often see is maybe a factor or a product of disuse rather than aging alone. This obviously has important benefits then for our ability on the golf course and or off the golf course, and will help us to maintain that muscle mass and strength and eliminate some of those risks we mentioned earlier around functional decline, a loss of independence, and falls. Okay. Another thing that can often hamper our golf performance is injury. Time away from the golf course due to injury is obviously going to have a knock-on effect, not only on our general health, strength, and fitness, but also on our handicap. So injury can often be the start of that disuse that we mentioned, okay? Post-injury, resistance training is really important. It's been shown here in a number of studies, and we see it daily here in the clinic, that it improves function, reduces pain scores, helps improve strength and gait. So strength plays a fairly key role in keeping us on the course, as well as benefiting performance, as we've mentioned. If all of that doesn't sway your opinion on the necessity of strength as a part of our exercise routine, this particular meta-analysis looked at nearly 2 million participants over 38 studies. And basically what they found with this was adults with higher levels of strength had a lower risk of death when compared to those with lower levels of muscular strength. Okay. So as a general guideline, in 2015, the WHO changed their guidance to include strength training twice per week. And basically those guidelines look like this, okay? So trying to incentivize 150 minutes of light activity a week. Again, if we're playing golf, we're probably ticking this box quite easily. 75 minutes of vigorous activity. So that's, increasing our heart rate, getting out of breath a little bit more. Strength training, as we mentioned, and ultimately trying to include some form of balance training and/or minimizing sedentary time. Again, if we're on the golf course a couple of times a week, we probably tick a couple of these boxes anyway, but strength training is maybe one that we're not going to tick whilst on the golf course. Again, it's important to note that these are generalized guidelines and do need to be adapted to the individual, but they do go to show the importance of strength. So by now, you're probably wondering, how does Rory lifting weights in the gym contribute to him hitting drives or performing well on the golf course? This review article examined the existing scientific literature regarding strength training in healthy, non-injured golfers. The study analyzed the relationship between muscle strength, swing performance, such as club head speed, driving distance, ball speed, and skill. Skill being handicap or score on the round. The results seem to indicate that 1, there's a positive relationship between handicap and swing performance, although relatively few studies have been investigated in this area. 2, there's a positive correlation between handicap and muscle strength. And 3, that there is a distinct relationship between driving distance, swing speed, ball speed, and muscle strength. The results go on to show then and demonstrate that training of the lower leg, hip extensors, trunk power and strength, as well as grip strength, are relevant for improved golf performance. This slide shows a sample training program or strength plan for a golfer. Obviously, it's important that these programs are individualized, so it is best to consult a professional when looking to begin any new strength plan. Ideally, we want to try and meet the individual where they're at. For example, someone who has a history of training regularly versus someone who's coming from a more sedentary base. This particular example is a 6-week program aimed at a relatively well-trained individual with a good experience of strength training. To show you some of these exercises, again, these are some advanced exercises for someone maybe who hasn't exercised or done some strength training before. To talk through some of these, so in the top left here, we have a rack deadlift exercise, looking to build up posterior chain strength. Here we have a hip thrust exercise, again, looking to develop gluteal and hip extensor strength. Again, these are going to be important exercises when we think of our follow through in the drive and developing that hip musculature. We have some upper body exercises here in our push-up, our single arm pull down, and our single arm press. We have some lower limb also working on balance here with our split squat, single leg squat working on our single leg strength, as well as our T-spine rotation here working on rotational mobility and flexibility. So here are some general guidelines for strength training. As we start as a beginner, we want to focus more on lighter resistance or utilizing bodyweight exercises. We might start with slightly higher repetitions and lower sets, and that can progress into heavier weights with lower volume. Again, the sessions per week might be reduced or less to start, 1 to 2, and that could gradually progress as we become more advanced. In terms of exercises, again, some example exercises here. These are obviously not all of the exercises that might be used, but just giving you an example of some that might be used across a couple of different type of movements. Okay, it's not necessarily the case that we might move linearly from one, whereas we might be a little bit more advanced in one area, but struggle with upper body strength and be a little bit down the pecking order in upper body strength. Just to worth noting. Again, I won't talk you through all of these. Some of these have already popped up in the video earlier, but more just to give an example of some exercises that can be utilized in a strength training plan. Next, then, it would be remiss not to mention the importance of cardiovascular exercise, although I think everyone understands the benefits of cardiovascular exercise in terms of weight gain, reducing inflammation, and reducing the risk of chronic disease. So just to quickly talk through it, this particular meta-analysis looked at 33 studies with over 100,000 participants. And basically what they found here was that those people with better cardiovascular fitness had a lower all-cause mortality or incidence of coronary heart disease and cardiovascular disease, and essentially recommends that working on our fitness, whatever form of fitness that might take, is beneficial towards all cause of mortality. So some guidelines around cardiovascular fitness, and again, this is probably something we're mostly familiar with, is that we want to try and get out of breath. Again, if we're playing golf, we probably get that lower intensity exercise ticked off, as we mentioned earlier, from the WHO recommendations, but maybe we could challenge ourselves a little bit more with some slightly more intensive activities throughout the week. Again, that starting point is going to be dependent on your current level of fitness. Examples might include some fast walking and running, cycling, swimming can all be effective methods. Naturally, with golf, we often enjoy the social aspect. That should be no different for whether it's strength training or cardiovascular training. Having a training partner and someone to keep you adherent and honest is often beneficial. And then trying to make measures of progress. We track our handicaps, we track our scores on the golf course. It should be no different than in terms of our training off the golf course as well. And lastly, again, as I mentioned, getting advice. If you're unsure where to start, that's where getting advice from a professional is key. General guidelines here, again, not targeted at anyone particularly, and will naturally change dependent on your own current levels of fitness, but aiming for 3 days a week. Some of that might be made up from our golf, but outside of the golf, then what are we doing, or is there other activities we could include there? Again, we mentioned about perhaps looking to utilize some higher intensity exercises where we're gonna push that heart rate into the higher ranges or higher levels. Again, our steady state stuff is going to be largely ticked off from our golf course, especially if we're playing a couple of rounds a week. But then the interval training option might offer a good alternative to challenge those more intensive cardiovascular sessions and see those benefits, as we mentioned. Here then at UPMC SSC, we offer some bespoke fitness testing. It is covered by a series of different health insurers. VHI in particular offer to fully cover the cost of our fitness testing here. The fitness testing covers a variety of different elements. So we'll look at body composition, upper body strength, lower body strength, as well as power. We can also include swing speed assessment, as well as a cardiovascular fitness test or VO2 max, which can be performed on a treadmill as shown or on an exercise bike. Testing is obviously one part of the equation, but then it's implementing those testing results into a bespoke program for the individual, depending on what their goals are. And again, off the back of all this testing, then we can offer a bespoke training plan as well. Again, that's all included as part of the VHI package, as I mentioned earlier. So if you would like more information around that, you can email the email below, or if you do have any further questions, I'd be happy to answer them now as well.
Tommy and Ronan are here now. Thank you, Tommy, for that presentation. So they're both here now, and we're going to go through, there's a lot of questions coming in. So the first question is from Fiona about, do you see a different distribution of golf injuries between male and female, firstly, and then at different ages? Now, there are two more questions about teenagers in there, so I'm going to combine them with that as well. But if we just start with the male and female.
Yeah, no, great question. I'm happy to answer that one. So definitely in female golfers, we definitely would see quite a lot of hip-related symptoms generally around the outside of the hip or the lateral hip, I suppose, traditionally might have been known as trochanteric bursitis. But generally, we find that it seems to be a lot related with the gluteal tendons and generally weakness around this area. So strength and conditioning forms a huge part of treatment of that. From that side of things, I suppose, in terms of the older male golfer, as we discussed in the talk, lower back pain and elbow issues seem to be very common in the recreational older golfer. And osteoarthritis obviously plays a big part in terms of knee and hip as well. So I suppose from that male versus female, definitely there would be some more common in females than not, and likewise in males as well. In terms of the teenage golfer and the younger golfer, tend to see more bone stress injuries in lower back as probably one of the more common injuries that we would see in the sports surgery clinic with golfers of that age group. And generally they'll have come in, they've played quite a lot of golf, they might be on a number of different sports teams outside of the golf course itself. They may be deficient in a number of different strength metrics, and oftentimes their pain will be there for quite some time. And that's where I suppose we work really closely with the strength and conditioning coaches as well, in terms of seeing to identify where exactly their deficits are and to try and build the structures around the joints and bones back up again. And I know Tommy has great expertise in that area as well.
Yeah, Tommy, that part of that was people were asking, what would you recommend for teenage golfers? One, to be mindful of, and secondly, what age should they start strength training?
Yeah, another great question. So in terms of what to be mindful of, it's going to be around exercise technique and guidance, ensuring that they're performing, I suppose, the right exercises the right way at the right intensities, and have someone to give them feedback rather than maybe just picking random exercises off the internet or trying to copy maybe what the elite pros are doing, who have 10 to 15 years of training behind them. In terms of age, there's never really too young, it's finding the right exercise for the right age. Obviously, a young person or a 15-year-old with no experience of lifting weights isn't going into the gym and lifting maximally in the gym, but they could start on softer resistances or body weight exercises. So they're still going to develop strength and motor control and capacity, but not using the heavier kind of loads that you might have seen in some of the exercises or videos there. And then over time, as they develop competency and get better at the lifting and techniques, then they can look to progress onto more challenging, more difficult or more intensive or heavier exercises as they get older and or more competent. So I wouldn't necessarily put an age on it, and more about a competency-led approach. So as they get better at it, they then are able to progress to harder or heavier exercises.
Okay. Thanks, Tommy. His question here, I've been diagnosed, this one for you, Ronan, I think, with golfer's elbow, having played for over 35 years. I've tried microneedling, a wear and tear fabric elbow support, neither helped, but recently I've been in much less discomfort. Is it likely that pain will return, and what would my options be?
Yeah, no, thanks for the question. I think we covered quite some of that in the talk as well, but I suppose just to harbour on some of the points on that. So golfer's elbow is generally pain on the inside of the elbow or the medial epicondyle of the elbow. Oftentimes it is an overuse injury, but can be often be related to technique, to the surface that you might be hitting golf balls on. Oftentimes we will find that people that hit balls from a hard driving range mat actually tend to start to irritate the medial elbow as well. So there can be, I suppose, first things first, identify the triggers. Is there differences in their grip strength that's changed their trigger to the elbow pain itself? I suppose, thankfully it's gone away in your case, and will it come back? Hopefully not. If it does, and if you've had it for 30 years, I suppose one question I'd ask, is it truly golfer's elbow, or is there something else going on? So I suppose having it fully assessed on that front. We see quite a lot of golfer's elbow in the clinic, and as I mentioned in the talk, we have a number of different modalities available to use, I suppose, if the traditional approach isn't helping. But oftentimes getting the exercises right are the most important part, and to try and add some recovery into the week. But we do have the options of extracorporeal shockwave therapy and injection options like platelet-rich plasma and or corticosteroid as well that can be helpful in certain cases as well. So I'd get it assessed if it does flare up. If it's gone away, hopefully it'll stay away.
Okay, thanks, Ronan. Question here from Nick McGrath. Is yoga stretching good for your golf game, or is there other stretch routines that you would recommend to prevent injury occurring? As would only play at the weekend and walk straight to the first tee without any warm-up or stretching.
Okay, yeah, a couple of bits in that, I suppose. So, in terms of yoga developing strength, it's going to depend. Depends what your training background and history is there. If you're new to it, certain poses might have a beneficial and strengthening effect. In terms of if you do have a large experience with yoga, it's about making them poses more challenging or more difficult, or perhaps introducing a new form of exercises to continue developing strength. From a flexibility perspective, it depends. If we're limited in range, then of course, yes, flexibility, stretching, and certain yoga poses are going to help with that, of course. So it can be beneficial. But if we already have full range of motion and can complete, our full backswing and are happy with that, we're probably not going to get a huge amount more benefit out of that, and potentially could be better served going after different types of exercises. From a warm-up perspective, yeah, it's going to be pretty crucial. Golf is obviously a game of skill, so I would suggest for your warm-up, you want to try and make it as golf-specific as possible, which is probably going to mean getting onto the putting green or chipping or into the nets. I suppose the counter argument there is that a game of golf might last 4 or 5 hours, so you want to be careful that you're not fatiguing yourself before you go out, and then you blow up over the last 6 holes. So it's about trying to find the sweet balance there between enough to physically warm up, mentally warm up, but not fatigue yourself so that you're going on to the first tee tired or paying for it later, so that you can, I suppose, optimize your performance on the first tee, but also still maintain that then onto the 18 tee box as well. But I would be inclined to suggest keeping that as golf specific as possible, rather than doing a host of different exercises that aren't necessarily specific to golf, tiring yourself out and then have a negative result on your golf game, but maybe you feel better for it. So it does depend there a little bit. Yeah.
Thanks, Tommy. Now, any cure for the pain of missing short putts from Niall? Can anyone help him with that one?
I have a little bit of experience with that myself as well, so a little bit of trial and error with treatments and whatnot. But what I found helpful is the Bob Rotella Golf is Not a Game of Perfect as a golf psychology book to be helpful on that front. The dreaded jips that we all fear. Unfortunately, I don't have the solution to that. If I did, I don't think I'd be on this webinar. But I think in terms of, I suppose, the psychology of golf, I suppose that we all know how important that is. So that doesn't just come back to missing short putts, but I suppose on the first tee and all that comes with it. It's not just your physical health, but obviously your mental health. Not only the boost it does give for your mental health, but actually focusing on your performance psychology, I think, can be helpful with your game, and then obviously with your health as well in the future. So that's just Bob Rotella is a plug there.
Thanks, Ronan. Someone said, Kieran, I see a lot of influencers talking like doctors on Instagram in relation to mobility after one TP1 course. Have you seen many injuries from likes of this?
Yeah, I might take that question as well. Look, there's a number of different courses out there. I know that course, familiar with it as well. It's quite helpful from a functional patterns and a functional movement of the golf swing. It's interesting. I suppose the challenge is that I wouldn't brand all golfers under the one brush. I think taking an individual approach. We know that everyone runs differently, everyone moves differently, everyone swings the golf differently. So I think by giving everyone with the copy and paste approach to management of their injuries, I suppose it just doesn't really work for the most part. So taking an individual approach on both their movement of their golf swing, their movement in general, their strength, and their injury, I suppose, is the most important aspect there. So yeah, there is benefit of some of those courses, but I think treating everyone as an individual rather than as a group is the most important takeaway from that question, really, for me.
Okay. Now, so Anya here's asking about returning to golf, anything to be mindful of return to golf after a hip replacement. Now, I know we're always going to say anyone that's asking about after certain surgeries, they should always check in with their surgeon first on their 6-week review or their 3-month review, whether it's time to go back. So I suppose once they've been given the okay by their surgeon, then what should they be mindful of once they return out there?
Yeah. So like you said, it depends on what stage of the rehab journey they're at there. The key thing is that it's progressive. We're starting light and gradually building up. So, very early doors, obviously it's going to be a sore and stiff hip. So we want to try and gradually progress the range of motion there. We want to get back into building up the strength in those muscles that are going to be sore and deconditioned after the surgery. It's about getting back walking with a normal gait pattern and then gradually increasing that walking volume. From there, once we've been given the all clear and we've kind of ticked those boxes, then maybe introducing some rotational type exercises. So kind of practicing the golf swing again. And then it's a gradual progression from there. So, initially it's probably getting down to the range and practicing at the range under, like, I suppose, your own kind of time remit. And then gradually building up your golf volume. So starting at 9 holes or even 6 holes and just gradually progressing that. The really important thing is that we're back very comfortable walking with our normal gait pattern before we're looking to take on 18 holes, because obviously there's going to be a lot of steps over the course of a round. So we want to have built up that bit of conditioning off the golf course so that we can take it onto the golf course.
Thanks, Tommy. Okay, thank you. What is the best recovery for Achilles tendonitis after numerous physio appointments? It's still not clear up to 9 months. Is further investigation a better option? Example, MRI, X-ray, and a consultant appointment.
Yeah, look, I suppose tendinopathy in general, we would see quite a bit of that in the sports medicine department, and Achilles tendinopathy would be really one of the most common things we would see on that front. It's a common issue. There's multiple different causes to it. I suppose treating it on a case-by-case basis is the most important. We could get into the detail of it in terms of different types of Achilles tendinopathy, those that occur at the insertion point of the heel versus those that occur at the mid portion or the middle point of the Achilles tendon itself, are treated very differently. There can be associated conditions, inflammatory type conditions with the insertional type Achilles tendon problems. So oftentimes that involves some investigations, including blood work. But for the mainstay, load management and treating tendons, especially Achilles tendons, with appropriate exercise and appropriate loading exercises is the mainstay of management. There are additional adjunctive treatments that can be helpful from symptoms, and if there's more significant injury, like extracorporeal shockwave therapy, as we said, and obviously injection therapies can be at times helpful. But again, would depend on the detail of the injury itself. So if somebody is struggling for 9 months with an Achilles tendinopathy, there is help out there, and don't be afraid to reach out.
Okay, thanks, Ronan. Tommy, one for you. Is swimming considered a weekly strength session?
So swimming would probably fall more on the cardiovascular side of that equation. Obviously there's some resistance involved in it, but typically no, it's going to be more of a cardiovascular type session. So still a lot of health benefits going to be associated with that. But if we are specifically trying to train and develop strength adaptations, there's probably more or better options out there, like some of the ones we mentioned in the talk earlier.
Okay, Ronan, Ben, is it dangerous to play golf with a TFCC tear that was non-surgically treated 5 years ago? And can such injury heal? Can you give more information on the ultrasonic treatment mentioned by the doctor for the treatment, or can you recommend a treatment for thinning cartilage in TFCC tears?
Yeah, so TFCC tears they're basically tears in the little piece of cartilage at the end of your ulna, or end of your forearm bone, basically, and your wrist joint itself. I suppose firstly, if you were to get an MRI of your wrist, and we MRI'd every golfer in the country's wrist, we'd see a lot of TFCC tears that mightn't actually be causing the problem. So it's really important to correlate, or to basically correlate your MRI findings with your clinical exam to make sure that that's exactly the structure that's causing the problems. Yeah, and if it's a symptomatic, or if it's a TFCC tear that's causing you problems and causing you symptoms, generally the first line treatment for that will be injection therapy, will be considered to be injection therapy. We generally do those injections under ultrasound guidance. Generally it will involve a corticosteroid type injection. If it becomes very problematic and it starts to irritate the joint significantly, and injection therapies aren't settling it, sometimes people go on to have keyhole surgery for their TFCC tears. But again, a little bit like the Achilles tendon problem, is somebody is struggling with wrist pain for 5 years. We're here to help if needs be. So there's lots of options out there with regards to management options, thankfully now.
Thank you. Tommy, someone's asked here, let me just get that question. Tommy, do you think the Pilates reformer has part to play in offering a method for general injury prevention?
Yeah, again, I suppose like the other questions there, it's going to be, you have to take it on a case-by-case basis. So certainly it can be beneficial. A lot of people will find it beneficial in terms of developing strength and conditioning throughout the core and kind of gluteal muscles. So absolutely it can be beneficial. And ultimately it depends what level we're coming from. You know, if someone's been doing reformer Pilates for 5 years, maybe it's not as beneficial to them anymore, and there are other options. If you've never done it, then it's trying to find the appropriate level to start at that should help then develop strength. So absolutely it can be beneficial. Like I said, there's 101 different exercises, 101 million different exercises we can do to try and develop strength. So it's not necessarily just the couple that I showed in the video earlier. There are lots of different options out there, and reformer Pilates is certainly one of them. Yeah.
Okay, thank you. Can strength training help tendinopathies around the hips in women in their 60s if they're playing golf?
That for me?
Yeah, or Ronan?
Well, oh yeah, absolutely. Yeah, absolutely. Yeah. Similar to kind of the hip replacement question earlier, it's going to absolutely be beneficial, and certainly a part of what I mentioned in the talk about maybe that disuse or that loss of muscle mass and strength that we alluded to earlier. And strength can help offset that. So it's absolutely going to be beneficial. Again, the key with tendinopathies is finding the right kind of loading. You know, it's almost like a Goldilocks effect. We don't want to be too hot and too hard, or too soft and too light. So we want to try and find the right amount at the right person at the right time, and then gradually increase that progressively. So it's hard to say specifically what the best exercise for that person is, but certainly strength training as a general concept is going to be beneficial for sure. Yeah.
Ronan, Martin here said he's 50-year-old. His significant number of his golf friends are having difficulty with their knees, specifically getting their knees replaced. Is this common? So it's probably more about you mentioned osteoarthritis in your talk, so
yeah. So thankfully, I suppose golf is not a very heavy loading sport for your joints in many ways. It's a low to moderate intensity exercise, so it's unlikely the golf has caused their knee osteoarthritis, is what I would say. In many ways, golf can be a form of management and treatment of knee osteoarthritis. We know movement and exercise is probably one of the most important parts of management for people with osteoarthritis. So I'd suspect there's probably other factors at play there for that golfer and his friends as well.
Okay, thank you. 68-year-old golfer, arthritis in the spine. There's a few spinal questions here. Will exercise help to reduce the amount of the chance of getting injured if they're going to play golf? And someone else is talking after spinal surgery, say a microdiscectomy. Would core strengthening help them before they go out to play golf? So there's two spinal questions there, I suppose, for either of you, if you both want to talk about the spine.
Yeah, I might start on that one first. That's okay, Tommy. I suppose in terms of the spinal arthritis, I suppose, so again, common for people to have facet joint arthritis or a joint arthritis in their lower back oftentimes, and strength definitely plays a huge role in management of that. Just making sure, I suppose, in terms of other potential reasons for having back pain, not to be overlooked. So not just to put it down to joint arthritis. If there is other issues, if the person is having leg pain, weakness, nerve symptoms down their legs, you know, don't ignore is what I would say. Just get it checked. But yeah, from most definitely, strength training will play a huge mark. And again, like post your microdiscectomy, again, once you've got the clearance from your surgeon that you're able to return to your exercise, then working alongside your therapist, be it your physiotherapist, strength and conditioning coach, to try and help build strength and improve function and movement is going to be a huge part. And I know Tommy has interest in that area as well.
Yeah, Tommy, I think that is a key question there about building up that core strength for those people with spinal injuries, also undergoing spinal surgery.
Yeah, absolutely. Similar to the previous, it's about trying to find the level they're at now, introducing the appropriate exercise, and then gradually increasing that and building that up over time.
Okay. Lovely, thanks. Someone here is asking heel pain. Is there anything to do with heel pain that gets aggravated when they're playing golf?
Heel pain, I suppose it depends on the cause of the heel pain. Most commonly, I suppose, to kind of take the top one, most common cause of heel pain in golfers or in people that are active will be probably plantar fascial pain or plantar fasciitis, which is a tricky diagnosis in its own right and a difficult thing to manage. If anyone who's had it will know that it can last for quite some time. And the way I like to discuss management with people is really to try and push the train so far down the track that we can kind of speed it up to resolve it. And with that, I suppose you'll have a number of different stretching calf exercises. People wear night splints at night time that can be helpful as well. They'll have all tried the cold water bottle on the foot. And oftentimes shockwave therapy can be quite helpful for those type patients. If the patient is still not responding to those type of management options, then we do have injection options. Again, platelet-rich plasma and corticosteroid can be considered. If the first line management exercise aren't improving. But yeah, that's probably most common cause of heel pain in golfers and people that are very active.
Lovely, thank you. A few people here asking, I don't know whether yet, Tommy, about following rotator cuff surgery, about going back to play golf after rotator cuff surgery.
Yeah, so look, that's going to be very similar to the hip question earlier. Yeah. So look, it's going to be based off the guidance of your consultant and the physio that you're likely working with, and working closely with them and following a gradual progression again in exercise intensity. So regarding that, again, you're going to be pretty stiff and sore early doors. There's going to be a reduction in the range of motion. That's obviously going to limit your ability to swing. So it's about gradually increasing the movement, the range, the strength in the shoulder, and particularly the rotator cuff, and then gradually reintroducing things like your golf swing. So probably doing it in more of a kind of static, controlled environment first, progressing onto the range, and then gradually building up your golfing or swing volume. Obviously, the lower body or the walking point of golf probably isn't so much a factor there, but more just the amount of balls you're hitting. So I'd use that as a key kind of metric. How many balls am I hitting per session, and gradually increasing that over a period of time.
Okay, lovely. Either of you can answer this question about the wrists. So someone's talking about wrists get sore randomly, strained from golf strikes. Any ideas to strengthen the grip strength?
Yeah, I suppose that if grip pain with golf or wrist pain with golf is really common, especially in the professional golfers. It's probably the most common reason that they'll kind of seek medical attention in many ways, and oftentimes it is an overuse type injury in professional golfers. And in amateur golfers, it can be more related to their swing, to the mechanics of the swing itself. They may well have an injury that has just flared up and occurs, and it could be that TFCC, it could be the wrist joint itself. So I suppose it's hard to give specific recommendations on a general wrist pain, but I would look at your mechanics, have a chat with your golf pro in terms of your swing to see is it related to your impact, or is there another thing at play? And if it doesn't seem to be settling with those, then get it checked out. There's another question actually there on stress fractures I might answer before we finish as well, if that's okay. Are hip stress fractures common in golfers? No, thankfully they're not. Do see quite a lot of hip stress fractures and pelvic stress fractures in athletic individuals, so in runners and endurance runners particularly. The stress fractures that are common in golf would be in your younger golfers, so your teenage golfers that play quite a lot, and they would be in your lower lumbar spine region. So back pain that's sore at night time that wakes somebody up from sleep at night time in a young teenager, that is worse with exercise, can be signs of a lumbar stress injury. And as we spoke during the talk on the Q&A, there will be a period of time needed for healing of that stress fracture, but then after that, the key component of their management will be strength, and will be building the strength around the lumbar spine to prevent it from happening again. But yeah, thankfully not too common in terms of older golfers. The compression fractures in older golfers might be related to osteoporosis, and I think we cover that in the talk as well. But yeah, no, hip stress fractures are not something we see too frequently in golfers, not related to the golf anyway.
Yeah. Someone's asking, what is the best way to treat golfer's elbow?
Yeah, I suppose we covered some of that in the talk as well.
Yeah.
Yeah, so I suppose identifying the triggers, making sure that the exercises are appropriate for that person, making sure the diagnosis is correct. And if all is not settling with those three approaches, then considering extra management options like your shockwave, like your injection therapies potentially, and working alongside your golf pro in terms of your swing mechanics, and to see if there is a trigger in terms of your actual swing. Is that why you've developed it? But yeah, I suppose we covered a lot of that in the presentation, so we probably cover that in greater detail on that.
Lovely. Thanks for both joining us tonight and everyone that's joined us tonight as well. If you're interested in any of these talks, they will be up on the website. We do have other talks up there. There are previous talks on golf. We have ones for hikers, runners, hip or knee replacement. We cover a lot of subjects. So if you want to go in, there are public talks available on our website. We will be sending a survey out. If you could fill that in, that's great. It's always helpful to know if there's anything that you'd like to hear about, and to help us produce our programs for next year as well. So just want to say thank you again to Tommy and Ronan, and good night to everyone. Thank you.